Hi, I'm Deanna Kosaraju. I'm the founder of Global Tech Women. I'm really excited about this next talk, the role of analytics in delivering health information to fight cancer in Australia. A very important topic, and it's really going to be fascinating to see what's being done in Australia, and the hopes that people will watch this session and also watch the recording and learn about some of the great work being done by these two women, as well as the organizations that they're representing. So I will take this opportunity to hand it over to them so that they can introduce themselves while I put up their presentation. So go ahead.
Okay, hello. My name is Chandana. I work at Deakin University in analytics, business analytics area. And I have with me here today Katerina Andronis, who works at Deloitte. And we are going to be discussing the role of analytics in managing health information so as to help fight cancer in Australia. So where we really began this research is looking at Australia and looking at all the states and territories and how we have public hospitals, private hospitals, general practitioners, a mixed bag, where when you have a patient who's approaching, or a cancer patient potentially approaching a GP, the GP then sends a referral to a hospital or maybe to a specialist, and the person then moves on to another state or territory, and the information then has to move from one hospital to the other. We don't seem to have the transfer online, completely online as yet. So if it does get transferred, and it gets interpreted completely differently. So what happens to this data in transit? It either gets lost in transit, apples become oranges, or if the patient really needs to then have a particular treatment area, then he has to start all over again. On the other hand, what happens is this data, which is very rich, gets lost, and it could actually be used for cancer research. And this is where we started saying, how can we use analytics to capture, record this information, which is really rich. It can be used for research. And this is where we came across data governance and the use of analytics. So Katerina here has over 35 years of experience in the health sector. She's a director at Deloitte in Melbourne. I'm working in the health informatics area, and this is my specialization as an academic. So we've been looking at how to capture this and doing a bit of research on this. So I'm going to hand over to Katerina here so that she can talk in detail about this. Katerina?
Well, good evening, everybody. It's this afternoon here in Australia. I'm very delighted to be here, and part of my experience, I also have, I worked in a cancer hospital here in Melbourne, Peter MacCallum Cancer Centre. It's a research hospital, and it's one of the most prestigious hospitals in Australia around cancer. That's all it does. It's a research hospital. And also, I'm also on the Fight Cancer Foundation board, so I really take an interest in cancer. So we'll start in our first slide. So a little bit of background around our challenges in health. So we have a lot of challenges in health, especially around data governance. We have some, and as I go through our talk this afternoon, I'll be able to give you some information and some examples of some of the challenges we have around data governance and how data is managed. So I might give you just sort of an overview first. So there is a lot of rich data in our hospital environment in Australia. We have some very clear defined data sets for our revenue. So all our acute facilities, our hospitals, our GP clinics, our specialist clinics have got very precise data governance around some of their data elements. But that's only one part of the pie. With activity-based funding here in Australia is what we use for how we bill our patients, how the hospitals get funded. It's quite specific, and we have international classification ICD-10 here in Australia. I know in America you're only on to ICD-9 and moving across to ICD-10. So we are quite mature in this aspect here in Australia. As you know, health is very complex. It's very it's a very challenging, it's complex, and we have a lot of interpretations of how we use our data. So that gives us quite a lot of problems. The next slide on 3. Some of the good stories around clinical data is around our activity funded data. But for research, we do have data sets for cancer. So I'll give you some examples around how we've set up some data sets around different cancer sets. So we have 12 cancer types in the hospital that I was working in around head and neck data, breast cancer, sort of liver cancers, a whole lot of data sets that each of the environments would actually then manage their own data. The challenge that we have in this space is the clinicians and the researchers will create their own data sets, but have a definition of what they believe it is. So if they were going to then share that information with other researchers, it would be very challenging because we would interpret the information as an apple and the other researcher might interpret it as an orange. So then we have to put in data governance processes. So next slide on number 4. It is really around how you create the data and how you manage it. And there have to be very strict guidelines around minimum data sets, data dictionary definitions, and how the data is created, how it's managed, and how it's used. In the research environment, especially when they're doing clinical trials, the data is obviously maintained in a very secure environment. It is managed by specialists and clinicians, but they can only release certain parts of the data as part of the clinical trial journey as they move along. And clinical trials can take 5-10 years and can be worth up to $1 billion. It's a very expensive business. So the data asset is a very important component of it. So we have to create systems that would enable us to manage this data in a very appropriate way. So they would release the data to the community as they release the results and as they release the information to the pharmaceutical companies that they're working with. So there's quite a defined process on how they manage and release this data. And some of the experiences that I've worked with in the past, the data would live in all sorts of strange environments, in the cloud environment, in off-the-shelf environment. So we have a lot of challenges with that, to the point where you make sure that the data is secure. And in Australia, we have data governance definitions on the next slide, which is very, very important. And here in Australia, you cannot have any patient data that lives outside of Australia. So if you're going to set up a cloud environment to have clinical patient data, the cloud server cannot live in America or Asia or Europe. It has to live in Australia. So there's very strict rules around how we manage and store our data. There are some very definitions around data governance, and I've got some of those up on the screen now. And in health, we generally use a combination of all of them, depending on the kind of data that we have and that we manage. So the next slide, slide 6, we have some themes. Data is an asset, and we have to make sure that there's an owner of that asset and who owns it and who manages it. And also we have to have a really good definition of what each of those data elements are. So again, these statements are relevant to not just in health, but in all other data governance areas in all kind of data that is managed. But in health specifically, especially in research, it is very sensitive, and it's how you manage and you release the data based on your research. So if you go to the next slide 7, how is data governance being done? What are the business imperatives? And what is data governance in a healthcare provider? And what is the value? So again, that is to us a very important concept and a very important process. So we've got some information research that we've created. And, definition of data governance is quite important to make sure that everyone understands the same meaning. So our data governance is a definition of exercise of authority and control over data assets encompassing the entire data life cycle: creation, storage, access, use, archiving, and disposal. And depending on what the project is, and then how you manage, how you archive it and how you dispose of it, and how you share that data with your research fellows. So one thing that we do in research, we have research is very collaborative. It's one of the key things that makes a lot of the stuff that we've been able to develop in Australia. For example, one of the radiotherapy services in the hospital that I used to work in, they were able to use very good data analytics and predictive analytics to change the way they provide radiotherapy services, treatments to patients. So, for example, depending on the case, on the care plan a patient might receive, they might have a combination of chemotherapy and radiotherapy. They were able to use data analytics to change some of the radiotherapy service. Instead of having 10 treatments, you would only have 4 treatments. So it's very precise. So the outcomes is the patient has less radiotherapy. It's delivered to the patient's site in a much more efficient way and has better outcomes for the patient. So in some of the data that is used is to change the way that they provide services. We also then use data for research, for clinical trials, and most of our research here in Australia is clinical trial-based research, which is then also shared with other clinical trials around the world. So Australia is only one part of the big picture. So, for example, breast cancer HER2 clinical trials, the hospital that I used to work in, does collaboration trial data with other hospitals in America. So how do you manage this federated environment of data where you want to share the data from Australia and you share the data from America, and it has to be de-identified? There's a whole lot of manual processes and tools that are used to enable that. So then they can collaborate, and then they would collaborate in sections of the data, and how they would use it, how they would access it. It has very, very tight rules, and we have like a data concierge type function. So there will be a team of informaticians who would manage that data and release it and bring in new data and share that data for the researchers. And then they will turn it on and turn it off as required. So it's a really quite a nice process. And it's done not just in Australia, but in other parts of the world. So we did a survey, and this in some survey that we did around data governance in healthcare, and the survey was a very good survey. But in the hospitals that we looked at here in Victoria, we had found that there was very little data governance in those hospitals, and the reason being is because they didn't find it important, or it was too much of a burden, a financial burden on the organisation to set up a data governance and to manage the data. They only had data governance on some of the data sets when it was used for funding purposes only. So they, they might have it as their strategy, but they would not actually implement it. So some of the challenges that they had was, as you can see, there was hardly anybody had started it at all. And when we looked into those organisations, the challenges that I have with the lack of data governance was quite evident because they would get out very poor information. For an example, there was a hospital that I was working on a while ago that didn't have any data governance, and they wanted to build a new theatre complex. And so they received some information that they did an analysis on, and were going to build the theatre, and it's only going to be a 5-year return on investment. When we had a relook at it and then put a data governance framework around that information and involve the key stakeholders that would be involved in the patient activity, we found that the actual investment was 10 years. So again, data governance was not in place, but when you put data governance in place, then you get really good qualitative information. Next slide, 10. So what are the challenges? So activity-based funding is what we do here in Australia, which really has very diligent processes and has good knowledge of the service, but that's only one part of your business. So from our revenue perspective, they manage the patients and the services, and they manage the revenue. And it's really important because by managing the patient, the services, and to get additional funding, so they can then put that funding into research. So it's an important, especially most hospitals in Australia, whether a cancer hospital or non-cancer hospital, they all have a research component to it. So it is a very important component for these hospitals. So a lot of the hospitals also have to have good data governance around their costs, because they have to understand what their costs are. So when they are doing chemotherapy services or radiotherapy services, they want to make sure that they understand the cost to the organisation. So there is a lot of work in this process and a lot of system and system work, and there's a lot of manual workarounds, and there's a multiple systems. So data governance is a very key component in making sure that everybody's working from the same script and the same menu. So on the slide 11, we created this functional footprint. This diagram basically shows us a health organisation on a page. So this is an example of one of the hospitals here in Victoria in Australia. And this tells us all the information that they require based on the functions that they do. So the top two rows, the top two columns, the care delivery support services, and the top right are all the clinical services that this particular hospital provides. So this is the information that they need for the funding. If you go to the next slide, on slide 12, we were able to group the types of data and information that they require to collect, so then they can do the revenue. So if we're looking at the slide, the information groups and subjects, there's a whole lot of data for the patient care services, the clinical support, and the non-clinical support. So there are a whole lot of data themes and data elements that are required to do this analysis, to do the analytics. And that's very important, and that all the definitions are the same, and they had a single source of truth. So one of the other challenges we have in health is there's no one single source of truth of information, and that causes us all sorts of heartaches. So by having a good data governance, you are creating that single source of truth. So if you go to our next slide on 13, we then have, as part of our costing, the very last two rows are our indirect costs elements. So we need to have an understanding of our indirect costs, which we have to proportion to the top two rows, to ensure that we then allocate those costs to find out the true cost of our services, let's say for a patient who might be having a chemotherapy service. So those things are really important to absolutely have an understanding of how you create that data and how it's calculated and used to get your pure costs and your revenue into an organisation. So in this slide, we we've got the sort of the bright blue diagrams on slide 14 on the cost element. So we were able to group data elements and from the different functions to implement into the modelling for finding out the proper costs for a hospital. So when they would go and do activity-based funding, they would have the indirect costs and the direct costs grouped together and modelled into their environment. And again, they're using analytics to help them make some good business decisions in the services that they provide. So on slide 15, we have some pretty standards, requirements and standards in Australia, very similar to America as well. We have a Privacy Act. So this is, as I said before, we can only store information here in Australia on servers that live in this country. So a lot of our technology is now moving into a cloud-based environment, which is relatively new for health. In the last couple of years, some of the major hospitals here in Australia and some of the health departments have actually moved all their data into cloud environments. So the Privacy Act, it took them quite a while to get there, but that's a very good source of using new technology to provide good access to information. The Freedom of Information Act is a framework that we use in Australia that a person can have access to their own information. So in Australia, every health facility that creates the health information, it belongs to them. It belongs to the hospital, to the GP clinics, the specialist clinic. It actually belongs to them. A patient can access that information through the Freedom of Information Act, so they can go and request their information. And so that's a very important thing. We in Australia have just developed the personally controlled electronic health record. So if you have a patient that goes from one state to another, so the idea is to enable to publish key clinical information into that patient's record, which lives in a cloud environment. So when they move from one clinician to another, from one state to another, they could have access to some core information. At the moment, what they're doing as this change matures, how it works through as organisations and people are uptaking this new environment. At the moment, when a patient goes from one hospital to another, they either get a copy of the record as part of the Freedom of Information Act, they can go and access it themselves, or a hospital can then email that information to another clinician. But in the case of cancer, it isn't always possible to have a longitude access to the record, because many cases they might go to a specialist hospital like the one I used to work in, have their core treatment done, but might go to their base location where they come from and continue their treatment in a local facility rather than in a facility that's based in the city. So about having not a complete record of that patient is a challenge when they're using it for research. So one of the things that our environment and what a lot of organisations are working towards is enabling a longitude record. So the privately controlled electronic health record that is in Australia is going to meet some of those needs. And 5 or 10 years from now, I'm sure that our environment here in Australia will be very different to what it is today. As people get more used to feeling confident to allow their information to live in a cloud environment, to have access like we do our banking, I see us in a few years' time being more acceptable, especially with the young generation who are very happy sharing all information known to mankind via Facebook or sort of social networks. But it's something that we as a country are moving towards. In Australian hospitals here, in public and private, we have Australian Council Healthcare Standards, which is quite important. And our the most important thing around data governance is in one of the accreditation standards about information management systems to be managed all the patient records and the health records. And you can see on this slide some of the important standards that we need to keep to. In Australia, we also have a health level 7 standard, which is also an international standard. A lot of countries around the world use this standard, and it's messaging. So that means we're sharing information from one clinical system to another. And as I said before, we have an international classification of diseases. In America, that's currently being converted from ICD-9 to ICD-10. And for us in Australia, it is used for our activity-based funding. That means the funding that hospitals get for their clinical patients. When it comes to research, the funding that our hospitals get, and it's the same in America, you've got funding bodies around grants, research grants. So that's the same process in every country. So Australia's not different to that. And they get funding from the Commonwealth government, from pharmaceutical companies, from sort of foundation companies that raise money for research. There's a lot of funding going there. Next slide on 16. So, what's the data governance framework? Well, again, information is the most important asset. So, an effective data governance framework is around our principles. We define what our objectives are for the data, our organisation, what are the roles and responsibility, and who's responsible for the data. And there's a lot of business processes around that, especially around research data, of how it's managed, when it's released, what are the policies are, and there's a lot of ethics in there as well. So there's a lot of ethics around research data, a lot of around in policies. We've got a lot of ethical standards on how you create the data and how it's managed and how it's delivered, our standards and our processes, and of course the technology. So that is quite significant for us. If we go to the next slide, 17. So our dependencies across our framework. So we have our guiding principles, which is our capabilities to achieve the excellence in data management, which again provides our traceable requirements and our high-level objectives. Our policies and what our policies are, what our guiding principles are, and what our actions are, which will support the principles. The standards, so we talked about data definitions, data governance, and also our HL7. And the really interesting thing that a lot of work that I do around a lot of health facilities is having data definitions is really, really important, and trying to encourage people not to create systems with free format text, but to have a standard framework so you can do data mining and data predictive analytics as well, and try to find a terminology around creating those data sets. And one project that we did for research was they wanted to do analysis of pathology and radiology results for cancer research on HER2. And what we use a NLP tool, a natural language processing tool, that took all this data, cleaned it, categorized it, and then converted it into IC10 coding, which then this free format text, which had lots of rich information inside of it, then combined with the coded data of ICD-10, was then able to bring a very rich picture. Because in our inpatient activity, we do coded data like ICD-10, but in our outpatient activity, which is our ambulatory activity, which is a lot of patients in cancer, like 80% of the hospital's cancer patients are seen in outpatients. There's some very rich information in there about their conditions, their problems, or their results. So to be able to codify the free format text data and combine it with the coded data, it was just blew our mind in some of the amazing things that they can do then, and do analytics and able to do some really good research and able to share that with some of the other data sets which is available around Australia and around the world, which is compatible. So some of the really good tools that are available these days is pretty exciting. So the researchers makes their life so much easier. And again, the processes are so important. One of the things that in health they don't do very well, they don't like change and they don't like processes. So when you create the data, you have to ensure that the process of how you collect it is the same. So when you're sharing that data set with another colleague, um, even if it's de-identified, you have to understand how that information is collected so you understand the definition of what each of the data elements are. We go to the next slide, 18. So our key action is really establish an organisation to manage, deliver and ensure quality data, because you know the old saying, rubbish in and rubbish out. And I've seen enough rubbish in and rubbish out to last me a lifetime. We need to enable the business to move beyond our project or our program approach to an enterprise data management capability. Data owners who are accountable is so important. So the data concierge model works extremely well, and have a data working teams, people who understand how the data is collected and how they can then um, do analysis on it. And I've worked in lots of hospitals where you've got this really good business intelligent team that collect all this data and they use all these fabulous tools, but they don't understand why they're collecting it and what it's used for. So when they then convert that information into the business, you've got all these problems. You know, it's so important to understand how you create the data. And it's important to promote global enterprise stewardship of the information around your defined data, policies, standards, and processes. That is seriously very, very important. So the policies overview on slide 19 is you need to translate the guiding principles into a pragmatic approach and not do theory. You really got to see how it really works in your organisation. You've got to develop minimum expectations for the management of data and security and data quality and controls. That's very important. And you've got to identify the roles of the organisation in how they comply with these policies. And then a framework needs to be provided in the creation of those standards and processes. And each data element will have different requirements. Each data set will have different requirements and different guiding principles depending on how they're created. And a lot of it in research is quite defined as well. So you can't, like clinical research can have different principles for different other types of research or analytics when you're trying to look into an organisation's information. Next slide on 20, we need to have a standard process overview. So we need to have the compliance. I mean, we need to monitor the standards, including the auditing. Auditing of standards is really important. In the case of ICD-10 coding, the auditing of that information is very strict. All hospitals in this country, private and public, do internal audits on a weekly basis to ensure that the information that they receive from the patient's medical record is complete and sound, and that the information from pathology and diagnostic tests is all available to ensure that when they do the coding for this information, it is all appropriate and nothing is missing. And then each organisation has external audits to ensure that there's completeness of the information, that you're getting the whole story. Developing enterprise terms and definitions of data and structures, and the codification laws is also very important. So, one person might set up on their own code sets and another person start up another one. So that's things like SNOMED is really important in this country, and try to get everybody across the line to start using codified structures like SNOMED and ICT taxonomies is really important. Define the data quality standards Obviously, security is very important, and there's a lot of rules around in this country around security around patient data. Like there's different rules around your banking data. There are some significant rules around patient data. Developing process to govern the data through its life cycle and guidelines is really, really important. So, you know, some of the horror stories in past lives where I've worked in lots of different hospitals, where the data for research is done in a hospital. I've worked in lots of research hospitals. They would sort of have the data on all sorts of environments, on hard drives, that sits on shelves, on other people's PCs, not stored up on the servers, and then the person leaves, and then sort of the data disappears when it really belongs to the hospital, not also to the individual. So that's very important that you have secure data and processes and guidelines, and you have to have processes for compliance measures for governance mechanisms. And that again, there are some very specific compliance rules for a lot of the data that's created. So on slide 21, so the technology overview, as we see from this one, it is the appropriate area for organisations should provide an architecture representation of the data governance. So it's very important to have the appropriate tools and technologies to manage to access the information and do documentation and the quality. So that to me is very important. Working closely with the technology people is absolutely paramount. Enabling information management capabilities for sustaining excellence in the data management. And these can fall outside the domain of the data governance organisation. And the strategy development and robust governance functions is seriously important. So basically here, data governance and capabilities should integrate with rather than overlay the business as their processes, key functions in the technology management. So that to me is very important. On slide 22, here's our data governance model. So we've got the executive sponsorship is really important. If you don't have that, don't even bother starting, because that is really, really hard if you don't have your executive sponsors, because they think it's all very additional cost. But if you don't have their support, then you're going to have some serious problems. Data owners is so imperative that they know how the data is created, how it's managed. You have a governance lead, so around the support function around technology and change specialists, and you've got to have your governance working teams and informatics specialists. So again, a lot of hospitals have business intelligence units in their research labs. They've got informaticians who just deal in the research data. So you have different types of people managing different types of data, and you've got to have the business data stewardship. So really your data governance framework should support the overall strategy of the organisation. So to me that is paramount. On slide 23, so the current status. So at the moment we've got we are missing in the health data owners. There are people who create data and it's like a short lifespan, or they run it for a project, or if they're using it as an operational data source, there's different people, the data owners, there's not enough structure in managing those people. Governance leads, we don't have that much in hospital, which is unfortunate. And governance working teams and information specialists is a luxury. And normally there's never any executive sponsorship. And the way that they do data governance in a lot of the hospitals that I've seen and have been experienced is they're trying to fix a problem. It's always about a reaction, not a being proactive. And they will put a whole lot of resources to fix a problem, but don't put in a data governance structure to then look at being proactive around using their analytics and being predictive analytics in solving some of their problems. Business data stewardship is normally business as usual. So some of the data governance functions that we do around ICT 10 coding is probably the closest you'll get in any hospital, but that's only one part of the equation. It's not all of it. Support functions and technology, again, that was also missing because you don't always have business intelligence units. Only very few hospitals around Australia have got informatics departments who are scientists or clinicians or nursing who work in this space who understand the data. Those are the key people who should live in that space who are managing their data. So on slide 24, so this table just basically gives you the rules, the roles, the executive sponsors, the owners, the governance leads, the working teams, the functions, and the business stewardship. You could use this model and you can set it up in a hospital. So again, the demand driven is around executive sponsors at the moment. It is if they have a problem that they need to solve, but they shouldn't be just for fixing up problems, but to use this as a normal framework for being proactive in how they want to manage their business and manage their research. So this is an operating view of a data governance organisation, and we've overlaid this in how it could look like in a health environment. So again, we talk about our data owners. So our functions, so data ownership functions are expected to have infrequent day-to-day involvement, but are accountable for their data subjects. We have our governance working teams around our subject area. So we've got subject experts maybe in sort of the breast research, or we might have subject areas in ICD-10, which is health information management. We then have our data support functions, so our quality management, our change management, especially when they are wanting to capture new data or create new data on what is the change process involved. One of the challenges that I've had in the past around creating new data sets. So for example, the clinicians, the head and neck specialists at the hospital I used to work at, wanted to create a minimum data set for clinical research for their patients. And the process that we went around trying to create those data sets was very complicated, to the point in what devices would you use to capture that data? At what point do you capture the data? Do you capture it when you see the patient in outpatient? Do you capture it when you see them inpatient? Do you have a paper form? Do you have a smart tablet? So there was a whole lot of change process in just collecting that data. And we had some successes because the doctor would spend hours and hours at night entering the data herself, so she could get this rich information so she can do her research papers. So the change management process is quite significant. And then you've got the business data stewardship about the processes, about how you would collect that information, and the community, and how your data community, what data source you can get from outside of your individual organisation or outside in your normal data community, for specialists. So again, each data set that is created is all done in a very sort of ad hoc way. But there are some very good tools coming out now that are available to a lot of organisations, and some of them are now starting to be used in a lot of the hospitals in Australia, that will make this whole framework a lot easier and more streamlined. Okay, in 26, again, it's just a bit more expanding on our governance working teams, a bit what I've just said previously. That governance working teams is about having a group of people working on a clinical project or a research project that will all define the minimum data set. And some of the funny stories I used to have is trying to get all the clinicians in the one room to agree to a minimum data set is how many doctors take to change a light bulb. Lots. And they all want to do it in their own different way. So having the governance around a minimum data set, if you get that part of the way, then your streets ahead. Again, data owners should be selected about the different information and the ownership and the function. and how they work together. So it is a very collaborative team. So, research is all around collaboration, and collaboration comes in various forms. And so you have to provide a good framework and good tool sets to enable collaboration and how you share information. And especially with research, you go through collaboration has time limits too, and what information you can release. So for research, you would have to have de-identified data when you're sharing data sources from different research folk, and how you would manage that, and then you could identify it. So some of the really cool things that have happened in this space, and this is in other countries as well. You have especially around genetics, you have all this data, and you find a unusual stream or a case for a patient. Then with proper governance structure that you have to MIFIN to go back and re-identify that patient, clinicians and researchers can then go back to the patient that has this issue, maybe um, around some of the results that they find. They can go back and then diagnose something else for the patient, and then provide different treatments for this patient. So there's lots of really good stuff that we can do in this space. So this one is a functional response. So this is on slide 27. So this is a RACI model, and this is sort of around about functional responsible across the data governance areas. So this is shows you who's responsible, who's accountable, who's consulted, and who's informed. So so that model is sort of very much overlays that and gives the people who are involved in data governance a clear understanding of where their boundaries are. So 28. So justifying the exercise. Attempting to justify an enterprise data governance will fail if you don't consider responding to a problem. The danger here is that there's a strong just to remain narrowly focused, and that's one of the problems we have in health. Everybody is reactive rather than proactive. Focusing on a single subject area is also very difficult, and the example that I gave you around building that theatre, they were sort of very much focused on one set data sets instead of focusing on the whole holistic view of the organisation. Leveraging the project with data migration. So again, when you're migrating data from one system to another, it's really important to understand the boundaries of the project. Searching through the benefits in the business case, the benefits that are data linked are unlikely to deliver planned benefits. This will expose the business at risk. And you need to also align that with process improvement initiatives. This is so important because when you're creating new data governance environments, there's always a lot of processes involved in making that happen. So this is slide 29, a business value model. So this is a driver model that allows business functions to be viewed in their sort of their functions. So this is a stakeholder value. So it goes from in this case, it's around a hospital, around revenue, operating assets, and organisational effectiveness, and it tells you who's all responsible. Slide 30. So some of the guidelines for tackling data governance is there's no magic bullet. It is a lot of hard work and a lot of communication and a lot of collaboration. You have to have a framework that will work for your organisation. Building data governance to become business as usual, not for some special thing that we're going to do data governance and we'll just do it for this week and then forget about it. It's got to become part of your daily work. And you start small. You scope small activities so people can get used to it. There's a big elephant that needs to be eaten in small pieces. And have a plan in mind. Like a roadmap is absolutely essential. and take steps with permanence. So once you've set up a model and you've set up data elements, it's become permanent and normal part of the business. And you've got to keep it simple, and you've got to implement the governance as data subjects are addressed, and also data quality reporting. And they do some of that in health in very good instances around ICD-10 coding, but they don't do it good in other areas. So that's it from me, and thank you for your attention, and I'd like to hand you over to Chandana. Thank you.
Thank you, Katerina. That was very insightful and very long. If the next step in this research is we're going to develop on this further, maybe test this models and try and look at it that way. At this point, if anyone has questions, we are able to take the questions or any other discussions. Okay. It looks as if we don't have any questions, so I think we can sign off at this point. We'll, if there is anything, we're happy to take it later. Thank you.
Hey, well, thank you so much for, gosh, a very detailed presentation. I think that the United States can definitely learn a lot from the great work that you're doing in Australia, and I hope that you're reaching out to your colleagues, which I'm sure you are in the United States, as they could certainly learn a number of things from this presentation.
Yes. Yeah.
Great. And I definitely will make sure that I have some friends in the space here in the US, and I will make sure that they watch this recording, because I think you're doing some really important work that should be shared with them.
Thank you.
Thank you.
All right. Well, thank you so much for attending this session. I hope you will join our next session, which will happen in 8 minutes with Linda Bernardi, Transformation into Fierce Technical Leaders, because that's what we all want to be. We want to be fierce. So stay tuned, and we'll see you at the next session.
Thanks.
Thank you, ladies.
Bye. Bye.